Welcome to Unstitching ADHD Urban Ed Talks. I'm your host, Dr. Stanley Aki. This episode is titled The Neuro News ADHD Edition, where we break down the latest ADHD research and connect it to practical strategies for kids, families, and educators. So today, I'm excited to be exploring a recent Stanford medicine study that has important implications for preschoolers with ADHD that should give every parent, teacher, and policymaker a pulse. This study, published in JAMA Network Open, found that 42% of children ages 4 to 5 diagnosed with ADHD were prescribed stimulant medication within just 30 days, skipping the recommended first step of behavioral therapy. The American Academy of Pediatrics clearly advises that young children should try 6 months of behavioral interventions before medication is considered. Why does this matter? You may be wondering. Preschoolers, according to the research, bodies don't metabolize medication the same way older kids do. Side effects like irritability, aggression, and emotional outbursts can hit harder, causing families to stop treatment altogether. Even more important, skipping behavioral therapy means missing the chance to teach children lifelong skills, routines, self-regulation, and strategies to strive in school and beyond. You see, behavioral therapy and parent training help families build positive routines, utilize visual schedules, and reward positive behaviors and strengthen parent-child relationship. So why are we skipping straight to medication? According to this research, one word: access. ACCESS. You see, too few providers, limited insurance coverage, overwhelmed pediatricians leave families without the therapy they need. You see, families deserve better. So what can families and educators do? Evidence-based parent training in behavior management is a powerful tool. And strategies like building predictable routines and structures, being intentional about that, using visual schedules to help kids stay organized, rewarding positive behavior and gently ignoring minor misbehavior with expectations, strengthening the parent-child relationship so discipline feels supportive, not punitive. Even for children who are already on medication, these strategies complement treatment and provide skills that last a lifetime. That's where our work comes in. At Warabi and Associates, and here on this platform on Unstitching ADHD, we focus on equipping parents, teachers, and caregivers with research-based strategies, skills that last far beyond the prescription pad. Let us all come together. This is a call to action. Invest in parent training programs. Train educators in behavior management so they understand how to create inclusive environments that students with ADHD can function. Advocate for equitable access to non-medication interventions. You can do that in your little way. We can all support in advocating for access to non-medication interventions. You see, ADHD is not just about symptom reliefs. It's about giving students, children, and their families the skill to thrive for a lifetime. For resources and strategies that align with science, please visit www.warebiassociates.com or listen to Unstitching ADHD Urban Ed Talks with Dr. Stanley Akio. We are available on all major podcast platforms and YouTube. Let's make sure our youngest learners get the care they deserve, rooted in skills, relationship, and support, not just prescriptions. If you find this segment useful, give us your feedback. Feel free to reach out to us if you have a story to tell. We are open to sharing and having conversations that will help us unstitch the complexities of ADHD. Awareness is key. Until next time, please keep this conversation going. Let's keep unstitching ADHD one conversation at a time. Thank you and have a great day.